Hi everyone, I'm André Moreau, and welcome to COVID-19 Vaccine in Louisiana, What You Need to Know. As the first group of people get vaccinated, it's happening as COVID rates are at an all-time high, cases soaring, people needing acute hospital care, healthcare systems being pushed to the limit. Well, tonight is all about what you need to know as the vaccine is now our way out of this pandemic. Along with Governor John Bel Edwards tonight, we have a panel of experts to answer as many questions as we can get to about the vaccine. We have Dr. Joseph Cantor, an emergency room doctor and the head of the COVID response team at the Louisiana Department of Health. Dr. Reynold Verrett, a pharmacist. He's also president of Xavier University. And Dr. Tina Stefanski from the Louisiana Department of Health and medical director for Region 4 in Acadiana. Governor, let me begin with you. You were present. You were there at Ochsner Medical Center at Jefferson Parish when the first cases were administered to healthcare workers. Why was that so important for that to be seen and for it to be healthcare workers?
Well, first of all, thank you, André and LPB, for doing this. This is incredibly important. And the development of and administration of a vaccine is a tremendous milestone as we work our way through this pandemic, but we've got a ways to go, and the vaccinations are going to be incredibly important. You know, the vaccines are obviously required, but the vaccine by itself doesn't do anything to help us end the pandemic. We need vaccinations. They started this week on Monday. I was at Ochsner when the vaccine showed up. About an hour and 10 minutes after it was delivered, they were actually putting shots in arms of healthcare workers. And that's important because we know that they are going to work every single day and have been since March, putting themselves and their families at risk of contracting this disease. And we are sending people intentionally, obviously, who have COVID to the hospitals. And so we know that that is one of the more dangerous environments. And so we're administering the vaccine there first. That is also following the ACIP recommendations, the Advisory Committee on Immunization Practices, to get to healthcare workers. And while it's including, obviously, doctors, nurses, and therapists, it's also for custodians, food service workers, all the individuals who work in that setting who can directly or indirectly contract COVID, whether or not they're engaged in direct patient care with COVID patients. So this is incredibly important as we get started. And by the way, we need those workers to be able to continue to come to work because the next few months are going to be very, very tough. And so it just makes all the sense in the world to start with our healthcare workers.
Well, Governor, thank you so much for that. Dr. Cantor, you're an emergency room doc, and you received your shot the second day. And what's being given is the Pfizer vaccine first, Moderna to come. Is there a difference between the two? What can you say about those two vaccines?
You know, the two vaccines are very similar. The safety profiles are both very good. Both of them are about 94, 95% efficacious, which is a grand slam in terms of vaccines. There's not a lot of vaccines out there that are more efficacious than that. And you're right, I got mine last Tuesday. I brought my card here to show everyone. And I got it in a room with a number of other healthcare providers and colleagues and support staff. And it was very emotional. There were a couple people who got it right after me who had lost loved ones in their family to COVID, and then they were here getting vaccinated. So it was a really optimistic time. You know, I'll tell you, every person now that gets the vaccine, numbers are going to go up every day. Every single person that gets the vaccine, that's a potential life saved, and it's one more step closer to putting this pandemic behind us. So this is a very optimistic time. But like the governor said, we're in the middle of a third surge, and we got to keep our heads down to get through this.
Well, funny you mentioned that because I was ready to roll up my sleeve if anybody had an extra vial around to get vaccinated. So I could leave feeling good about this. Thanks, Dr. Cantor. Dr. Verrett, you took part in the clinical trial to help get us to this point. Why was that so important to you?
Well, I think that, some people have to step up in the clinical trial. 30, 40,000, that's 0.1% of the population. Some people have to do it. But also the conversation that I had with one of my physicians, my personal physician, Dr. Evans Laborde, about the dearth of African Americans in the initial trials. So once I asked him for the data to do that, because it was important that we have representation of all people in the trial so that we can understand the safety implications for all people, so that when we come to having the vaccine, as we do now, the communities that are most affected can benefit from them. So it was important to understand that so that we are ready when that comes. And it was a happy day to hear the vaccines that arrived in Louisiana.
Well, thank you, sir. Dr. Stefanski, is the vaccine, and we've heard this, is it a magic bullet? And how long do we know that it lasts?
So this vaccine is definitely the best news that we've had since the start of the pandemic. It's incredible, a high degree of protection provided as a result of getting 2 doses of the vaccine. So it's great news, but as you've already heard, it's not time to let down our guard. It's going to take months for enough of the population to get the vaccine to where we get to that herd immunity. When we talk about enough of the population being vaccinated to really slow down the transmission and put it into the pandemic. So that's really months away. So we don't want people to think that this is a magic bullet and we can again start to let down our guard just yet. As Dr. Cantor just said, we're in the middle of the 3rd surge. We need to be really careful, follow those preventive practices to avoid any additional cases and poor outcomes. As far as how long does the protection last, we don't know yet. That's again something that's going to be studied over these next couple of months as more and more people are vaccinated and these pharmaceutical companies continue to monitor that. But we do expect that it will at least be months of protection. And the bottom line is that
You said months.
Months.
Right? Months.
Yes,
Okay.
at least months of protection, and that's what we need to get out of this hole that we're in with the pandemic. This is again great news. It's going to take more time to get enough of the population vaccinated.
All right, Doctor. Governor Edwards, as you hear her saying that, and as we continue this, when it comes to distribution and doses, what we're talking about, what is the plan that's been developed there?
Well, first of all, we've been working since June with the Vaccination Action Collaborative. The Department of Health put this together, and we brought people from the public sector, the private sector, higher education institutions together, and they've been meeting weekly. There are 4 work groups that have been meeting. Every work group has an equity interest that's attached to it to make sure, for example, that as we develop an order of priority, that we don't leave any segment of our population out who is within that order of priority. Important because of the disparate impacts that we've felt here in Louisiana across the country as it relates to COVID-19 as well. So that's been working really well with all of our partners in the state of Louisiana, but also with Operation Warp Speed and with the CDC and the FDA working together. That's one of the reasons that I was invited to the White House last week for the summit that they held. Is they regarded Louisiana's plan for receiving, storing, distribution and allocation, administration of the vaccines is one of the best plans in the country, and that's because of all the professionals that we've had working on this. And of course, going forward, we're going to try to align our plan with the ACIP recommendations that come down, focused on making sure that there's an equitable administration of the vaccine and paying particular attention to who is it that's going to the hospital in Louisiana and who is dying. Is it the older folks? Is it the folks who with the comorbid underlying health conditions? And then we want to make sure that those individuals, to the maximum extent possible, are the first to receive the vaccine, because that's how you make the earliest possible dent in hospitalizations and you save the most lives.
Governor, thank you. Dr. Cantor, now back to you. We've talked about who got the first shots, but who's eligible now? And when it comes to people who are non-essential workers, et cetera, and moving forward, how is that going to happen, especially with pre-existing conditions? And then you have some businesses who might say, we want our workers vaccinated. Teachers, lobbyist groups are saying something similar to that. So how do you work with all of that?
So it's a balance, there's no question. For the first couple months, while the supply of vaccine is still very limited, it's going to be prioritized, just like what the governor said, to people who are really on the front lines and people who are at the highest risk of dying or getting serious illness and being hospitalized. So right now we're in what we consider to be phase 1A. And that's frontline hospital staff, not just the docs and nurses, the entire support staff and front lines in the hospital, and residents and staff of long-term care facilities, starting with nursing homes. Hospitals got the vaccine this week and will continue to get subsequent shipments weekly basis until all of those personnel are vaccinated. And within the very near future, we'll have teams in a partnership with Walgreens and CVS going into nursing homes to vaccinate their staff and residents. That work will take a few weeks, and that'll bring us into phase 1B, where the circle widens to include essential workers, other people with risk conditions like advanced age or comorbid conditions, people who are homebound, and those discussions are happening very fast right now.
As rapid as this is rolled out, and the fact that we have it, there is that question about, well, how long does it last? And that would get people's attention. Without going too long into it, that would be something that continues to be developed as information is happening at lightning speed, right?
Yeah, you're absolutely right. We refer to it as durability of the vaccine. We know it's 95% efficacious at preventing it up to 2 months. That's what the study ran. We don't know beyond that yet. We have reason to believe there'll be good durability. But look, worst case scenario, you have to take a booster every year or two, and that's much better than being in the pandemic, and we don't even know yet if that's going to be required.
Dr. Stefanski, why is it necessary to get the 2 doses? We've heard some only need 1, but 2 doses, and making sure you do that in a timely manner.
Sure. So the 2 vaccines that we've talked about, over the last couple of weeks, so the Pfizer product and then the Moderna product, which will be considered before the FDA committee tomorrow. Those 2 vaccines require 2 doses to achieve that maximum efficacy. So when we talk about a 94 or 95% protection from actually being infected with this virus, which is just incredible, but you need 2 doses of the vaccine to get to that 94 or 95% protection. You do get some protection after the first dose, but it's going to be really important for people to get that second dose to achieve that level of protection. And so one of the products, it's after 3 weeks or 21 days, you get that second dose, and the other product, it's 28 days. So it varies a little by product, but again, it's going to be really important. We'll do a lot of work. The private sector, will be working with us to do a lot of work to make sure that people are notified and reminded of the importance of getting that second dose.
And how soon does immunity kick in once you've gotten those 2 shots?
Sure. So again, when we talk about the 94 to 95%, about 1 to 2 weeks after that second dose. So again, really important that after people are vaccinated, they continue to wear a mask and do all of those follow those preventive practices.
Yeah, it's something that we've never done before, right? In this way. So it's all new territory. Governor, why would people still need to wear a mask after they are vaccinated? And are there other mitigation measures that you just have to wait and see, or what are the plans on that?
Yeah, so the CDC recommendations are that we continue to wear a mask even after receiving the vaccine, and it's important for this reason. While we know the vaccines are 94 to 95% effective in preventing COVID, and by the way, 100% effective in preventing very serious cases of COVID based on the data that we have, there is no evidence yet that individuals still can't be exposed to the virus and shed virus. So they can be contagious even though they don't have the disease. And typically that's because the virus gets into the nasal passageways and so forth. And so unless and until we have data that shows that individuals stop being contagious, it is very important to wear the mask. The other thing, by wearing the mask, we inspire confidence in people that they can come into the store. Right now, the White House Coronavirus Task Force is telling people with comorbid health conditions, and if they're 65 or older, don't go into a single indoor setting if there is one person not wearing a mask. And so it's important that we wear the mask so that people can get out there and go to the store if they need to, go to the bank and engage in those essential functions. But until we have more information, we're going to follow all the CDC recommendations, and by the way, there will be more information coming, because as the Pfizer and Moderna vaccines, for example, go through the full licensure process, they're going to be getting more information about whether or not the vaccination does stop people from being contagious, just like it stops them from contracting the disease.
Governor, thank you. Dr. Brad, once the vaccine becomes more widely available, the role of pharmacies and pharmacists, what will that be?
Well, the role of pharmacists will be, as part of the healthcare system, they'll be available to distribute vaccines and inoculate people. Pharmacists have been inoculating and delivering vaccines for quite many years. And you forget that in the last 30 or 40 years, the pharmacy course study has changed to the PharmD, where they have a higher level of training. They manage patients who have chronic illnesses and things like that, and also delivery of drugs. In many of our pharmacies, they are also looking in our neighborhood, so we know that there's proximity. And also it raised the other issue of trust. The pharmacist is someone that people engage routinely with, can answer questions. So I think that trusted member of the community is also an important aspect in helping people engage and get their vaccines.
will you just simply go into a Walgreens and say, hey, I'm ready for my shot and roll up your sleeve, or will you need to make appointments, or is that all certainly known yet?
I will defer to Dr. Cantor on that, because I think those decisions as to the logistics of how we do that, you would have to be within certain categories that are eligible for the vaccines, and there'll be a way of verifying that.
Okay, thank you, sir. Dr. Stefanski, what are the side effects of people with allergies? We've heard of some instances in Great Britain, and so that raises flags. People are concerned about that, but you also have to know the whole story. So what are the side effects that can happen?
Sure. So the most common side effects that have been reported, and we have to remember that tens of thousands of people were involved in these clinical trials for both of these vaccine products, are local or some mild systemic side effects. So maybe some soreness at the site, mild body aches, headache. Again, for the most part, have been very mild symptoms. Typically, those symptoms most commonly occur after the second dose, within the first 3 days, and people recover within a day. And interestingly, if you consider that those are symptoms of a robust immune response. So when people exhibit those symptoms, it has nothing to do with COVID-19, but rather it's your body's immune system reacting or responding to the vaccine, which is exactly what we want. And those symptoms are more commonly seen in 18 and younger people, 18 to 55, again, showing that they've got a robust or a great immune response to the vaccine.
All right, Dr. Verrett, one of the concerns expressed is people not having faith in the vaccine or questioning it in the African American community and some other communities who may feel like they have and were in the past not handled well. So the level of trust with that, how is that being addressed?
Well, I think there are two dimensions to that trust issue. In the African American community, there are historical issues that had to do the misuse of black bodies.
Yes.
In the 30s and before. And what we should all remember that to build trust, we have to be very transparent as to how we are making decisions, who are behind the doors making decisions. For example, as I mentioned to a colleague, showing visuals, who are in the committees. For example, there are physicians who have been managing trials not only here in New Orleans, but also throughout the country. Many of the African American medical schools are involved in these trials. The other piece that is important is that the priority scales, even the decisions at the FDA and also at the National Academies of Science, many of the physicians and specialists of color, scientists like myself, are in the room making those decisions. We need to know that. That did not occur in the 30s and 40s. Also, we need to help people understand that the ethical framework of transparency had changed because of the mistakes that were made in the past. So that trust is important. The other piece I think I want to bring up is that there are also many misconceptions about the vaccines that are being spread out by pseudo authorities on our media. For example, that the vaccine will change your genotype, that the vaccine will actually have great damaging effects, and that even some even more extreme thoughts. We need to have trusted people countering those views so that we are not misled, as we were sometimes early in the epidemic.
So some of the things we've heard about, harsher side effects for African Americans. The truth of that is?
Not true.
Not true.
Not true. Biologically, we are the same. I would also remember that it's a historical thing that had to say that biologically African Americans were different from other people. That was a way of keeping control within the structure. Biologically, we're not that different.
All right, thank you, sir. Dr. Cantor, if someone had COVID and then recovered, would they still need to get the vaccine?
Yeah, we think so. We think it's actually going to add extra protection to what they already will have after getting COVID. We don't want people to get the vaccine when they're acutely ill. But afterwards, perhaps a few months afterwards, absolutely, it's going to be appropriate to get a vaccine, and that's already happening right now.
Okay, Dr. Stefani, back to you. If someone is healthy and low risk, why should they get a vaccine?
Sure. Well, as we said, this is our way out of this pandemic and back to normal life. So that's, of course, the ultimate goal. But also we know that although older people or people with these underlying health problems are more likely to have severe illness, we continue to hear about young people who do still struggle with COVID, have more serious illness. We have reported deaths in younger people, and some with some individuals going to have long-term side effects. So, the big picture is we need to move past this pandemic, and the majority of the population being vaccinated is how we get there. And then also I think people need to do it for their own health, and then hopefully to help protect those individuals that they live and care for.
Thank you. Dr. Cantor, we've talked about this on our program, the state we're in, as a matter of fact, but these vaccines approved so fast, much faster than any others. And so how did that happen? Is it still something that amazes you? And any concerns about that?
It really does. I mean, it amazes me in a really good way, I should say. Look, it's 12 months ago, we didn't even know the virus existed. And now, not only do we have a vaccine identified, but we're distributing it and administering it. What the federal government did here is fascinating. They took a number of steps that typically happen in sequence and put them all in parallel, did them all at the same time, and they made an investment in the pharmaceutical companies. They said, we're going to pay you to start manufacturing this. Maybe it's going to work, maybe it's not, but if it does work, we have that already produced. They won out on the first two candidates because Moderna and Pfizer look to be incredible vaccines, efficacious, very safe. So that investment by the feds really paid off because the companies have a head start on production. That's why we got authorization from the FDA over the weekend and dosages arriving in the state Monday morning. So that's going to continue to happen. What I am comforted by is that the level of transparency that the FDA is approaching this with is unprecedented. They are making every document public that they are reviewing when they consider authorization. It's voluminous. I mean, I read the Moderna documents last night, and it's 60, 70 pages. But everything that their committee is looking at is publicly available. And I'll tell you, after reading it, because I wouldn't put a shot in my arm without knowing exactly what there is to know about it, I've read both the Pfizer and the Moderna documents. I am very comforted. This is both a safe and efficacious vaccine.
But you know, you have a segment of people who don't believe in vaccines, period. How do you reach those people, which it's a large segment of, because they believe it triggers certain things or causes certain things?
You know, I think that's a challenge. And as Dr. Verrett said, there's a lot of misinformation out there. It's on social media. It's in informal gatherings. I think we have to approach it from all angles. At the end of the day, this vaccine is how we get back to normal. This is how we get back to normal. And the more that we spread that message, I think more and more confidence and excitement about the vaccine will be built.
Thank you, sir. Governor, the rural areas, the people who live in the country, how will they be given this vaccine?
Well, you know, we're going to be working through this literally weekly, and we're working through the orders of priority so that as more vaccines are allocated to Louisiana and distributed to us, we're going to broaden the groups that are going to be eligible for the vaccinations. And clearly, from the first order of priority, many of these are in rural areas. So we have rural hospitals, Tier 1 hospitals, that are administering vaccines this week. Within the next couple of weeks, we're going to have nursing homes all over the state of Louisiana, assisted living centers that are going to be administering the vaccine. So we're leaving no one out in terms of geography, whether rural or urban. And we're going to get to the point, at some point, where we get to the general population, and individuals in the state of Louisiana and elsewhere are going to get their vaccines for COVID just like they get the flu shots. So they will be going to their local pharmacist, whether it's a Walgreens or a CVS or an independent pharmacist, and getting those vaccinations done. So we're not going to leave anybody out. We're working really hard. If we see that zip codes are underrepresented, and this gets back to the equity interest, for example, we will have strike teams, both contract vendors that we have, but also National Guard, who will go out to those areas and make sure that we are administering the vaccine in those areas too, because we don't want to leave any area out. And I do encourage everyone to be mindful that when you are in the group that is eligible to receive the vaccine, when your priority is established in this time, this is a safe and effective vaccine. We have to have buy-in by 70% or more in order to get the levels of the percentage of folks out there vaccinated so that we can start to put this in our rearview mirror. And there's got to be a way to convince people not just to look at any source of information. They're not all created equal. And so make sure that when you look at the internet, for example, what is that source of information? And if you hear something that sounds negative towards it, go and fact check that with what's coming out of the CDC and the FDA. All of that is available too. And I'm encouraging people not to develop this resistance to the vaccine that's going to unduly delay or prevent them altogether from getting the vaccine, because they are putting their lives and the lives of their loved ones and people that they don't even know at risk.
Thank you, Governor.
Thank
Dr.
you.
Stefanski, each state has been given an allotment. It's been handled that way so far. What is we've heard this percentage, what is the number of people that need to be vaccinated to reach that herd immunity level?
Sure. So we don't exactly know a percentage yet, but we do know that it's the great majority of people. So we talk about 70, 80% of individuals in a community likely will need to be vaccinated in order to achieve that herd immunity. But we don't have that specific data or information yet. But again, the great majority of people.
And it's not just one state or the other, it's everyone, really.
Correct. Collectively as a community, in order to again move past this pandemic, we really need to take advantage of this vaccine and really not squander the opportunity that's been given to us.
Doctor, thank you. Governor, the vaccine is, of course, a great step forward to ending the pandemic, but not the virus. Again, why will we need to still wear masks?
Yeah.
Be careful. Be on the lookout for other viruses that may come?
First of all, we should all be encouraged, because we are administering vaccine now, and we're going to administer a second type of vaccine from Moderna in the near future in all likelihood, and then more will come online, and then the manufacturing will ramp up for all of them. But the truth of the matter is the mask remains more important in the short term to fighting this pandemic than the vaccine, because the general population is not going to be eligible. We're not going to have the vaccine available for them. So what do we do in the meantime to combat this third surge that is the worst yet? We had a surge coming out of the Halloween time period, the Thanksgiving travel and activities superimposed upon that, another surge, and now we're approaching Christmas. And I'm asking people to make sure that you are not going to engage in Christmas travel and activities and gatherings this year as you have in the past, because there is a great likelihood that someone, at least one person, will be at that gathering with COVID. And it's just an unacceptable risk. And right now we are seeing alarming increases on a daily basis in the number of people hospitalized with COVID. The capacity is eroding at our hospitals to deliver life-saving care, not just to COVID patients, but to non-COVID patients. And so while we should all be hopeful and thankful and consider it a great blessing that we have developed this vaccine that we're now administering that eventually will allow us to put this in the rearview mirror, we are not at that point yet. And so the mask, the distancing, the washing the hands, staying home when you are sick, all critically important. And then add to that list, get the vaccine when it is available to you.
All right, Governor, thank you very much.
Thank you.
I don't have to say it, you know it. We've endured and suffered through a year of unparalleled hardship. The vaccine offers the solution to move us forward and out of this darkness. Our thanks to Governor Edwards, Dr. Cantor, Dr. Verrett, and Dr. Stefanski. And thanks to you. Good night.